Across New York State, a vital public health initiative was launched in 2001 for people who inject drugs and other medications. Welcome to an overview of the Expanded Syringe Access Program, commonly known as ESAP. I'm Alan Clear, Director of the Office of Drug User Health here at the AIDS Institute at the New York State Department of Health.
What is ESAP? The New York State Department of Health's Expanded Syringe Access Program is a groundbreaking initiative aimed at increasing access to sterile hypodermic needles and syringes for people who use drugs and have medical conditions such as diabetes, multiple sclerosis, infertility, hepatitis, cancer, blood clotting disorders, etc.
Staying safe involves using sterile equipment, understanding the dangers and risks of sharing needles, knowing how to access harm reduction services, and knowing how to dispose of needles and syringes safely. The Expanded Syringe Access Program is harm reduction and better health comes especially the prevention of the spread of bloodborne diseases, particularly HIV and hepatitis B and C. In 2021, under Chapter 433, Public Health Law Section 3381, we eliminated registration for pharmacies, healthcare facilities, and healthcare providers to dispense syringes without a prescription to persons 18 years and older. Access to sterile hypodermic needles and syringes is a public health measure to reduce the spread of HIV and viral hepatitis without increasing drug use crime or unsafe discarding of syringes.
Let me tell you how the expanded syringe access works. There's a variety of points of access. Primarily, we have pharmacies, we have healthcare facilities, and healthcare practitioners. These places and individuals can sell or furnish hypodermic needles and syringes to anyone 18 years of age or older without any prescription. There is no limit on the number of needles and syringes provided, ensuring ample access for those in need. And many of these same locations have disposal services as well. Furthermore, all hypodermic needles and syringes provided through the Expanded Syringe Access Program are accompanied with a safety insert brochure explaining the proper risk of bloodborne diseases, proper disposal, and dangers of injection drug use, and how to access drug treatment, harm reduction, and information about HIV/AIDS.
Disposal. This one's a little tricky because the Expanded Syringe Access Program does not cover disposal costs, but will provide material for you to dispose of your used syringes safely. These come in the form of fit packs and medium and large disposal canisters. Once filled, these can be returned to syringe exchange programs, hospitals, or nursing homes. It's always good to call ahead to hospitals and nursing homes to ensure they are taking medical waste on the day you are set to arrive. Should you not have a formal disposal unit, place your used syringes inside a hard plastic or metal container and label it sharps. You can also find disposal units in your community at a variety of locations that can be found on the Department of Health's website. There are small and large disposal kiosks that we are going to show you. However, if you are disposing of your used syringes in household garbage, check with your local health department to make sure that your jurisdiction allows that.
ESAP provides alternative access to hypodermic needles and syringes by a voucher program. Vouchers are promoted through partnership with local pharmacies and local community-based organizations, ensuring widespread access to these essential health resources for those in need or experiencing financial hardship. As we have discussed, ESAP has many different access points. They're available at numerous licensed pharmacies, healthcare facilities, public kiosks, and local community-based organizations across New York State, ensuring everyone has convenient access. There is no enrollment process for providers who choose to provide ESAP services. However, programs who are funded by New York State Department of Health versus non-funded programs may be eligible for materials funded by the Expanded Syringe Access Program. For more information, you may contact myself, Adina Phillips, or the ESAP BML. All providers participating in the ESAP are required to adhere to the ESAP guidelines provided in the safety insert brochure. Participation in the ESAP not only expands your service offerings, but also plays a crucial role in promoting public health and safety within the community.
The Expanded Syringe Access Program supports providers with free essential materials for their role in the program. This includes promotional tools like signage and user brochures, alongside comprehensive training resources. For safe syringe disposal, the Expanded Syringe Access Program offers mailbox or wall-mounted disposal units and syringe containers, complemented by protective gloves and scales for accurate measurement during disposal. These materials, including clear decals for unit identification, are pivotal in maintaining safety and efficiency, reflecting the Expanded Syringe Access Program's commitment to public health through both access to and safe handling of sterile syringes.
With Project SafePoint and programs similar to ours, we offer a host of harm reduction supplies. So we have cookers, which are used to put the substance in and mix it prior to injection. We have Band-Aids, alcohol, as well as the sterile syringes, which are utilized for injection. And we also have wound care kits that you're going to use after injecting at the injection site.
And this right here is our Fit Pack. The convenience of the Fit Pack is that a lot of our clients are homeless, and so this particular bag can fit in your pocketbook, your book bag. It's just really easy to move around. And it accommodates about, I think, anywhere between 15 to maybe 19 needles safely in here. Once you pop it open, you put it in, you close it, there's no reopening it once it's been sealed. And it's very convenient to bring back to whatever site you're going to bring it back to drop off for your needle exchange.
This is our 1-quart syringe disposal unit. You can easily fit anywhere between 10 to 15 syringes in here, secure them, and you're going to be able to return those syringes or the sharp disposal container to either Project SafePoint or one of our other syringe exchange programs.
Hi, this is our 2-gallon sharps container. It can hold about 500 to 600 needles. This sharps container right here is great for when you're going to bring it back for the needle exchange program, because it keeps everything safe. Once everything is in here and locked, it does not open. There's a space right here where you put everything in, and then once you shut it, it's done, it's locked, and keeps all your disposables safe. This is our 8-gallon sharps container, disposable. It can probably hold about 2,000 needles in it. This particular disposable is great for our clients that can't make it in often to bring it back for drop-off, because it's an needle exchange program, so people bring their needles back. So sometimes they can't come as often as they'd like to, so they just let this pile up. Depending on how much they use, it just really makes for shorter trips back and forth to the site to drop them off.
So these tongs are a great device if you identify used syringes in your community, in a garden. They're great, ideal to keep you safe. You're going to use them, pick up the used syringe, and you're going to dispose it in a sharps container and then return it to either Project SafePoint or one of our other syringe exchange programs. So we have here our 1.5 disposable sharps container that fits perfectly in the wall mount. So you're going to open the wall mount, add your container, and seal it right up, lock it. There's a great display window so you can identify when the unit is actually full. These units are great for indoor or outdoor use. You can put them in community gardens, you can put them in bathrooms. They're great outside of a building, accessible for those who are in need to dispose of any type of used syringes.
It's important to note that ESAP does not reimburse providers for the costs associated with the actual disposal of the syringes. Providers are responsible for managing these expenses as part of their participation in the program. These costs can be managed by partnering with larger scale organizations who have medical waste contracts, hospitals, or SEPs. ESAP is more than just furnishing syringes. Pharmacies and providers also have an opportunity to educate and safeguard our community. Providers also play a crucial role in safe disposal. Offering guidance on proper disposal methods helps prevent needle stick injuries and environmental contamination. For those without access to a formal disposal program, it's crucial to safely dispose of needles to prevent injuries or contamination. Use a sturdy container with a secure lid, like liquid detergent bottles or metal cans, to store used needles. Ensure the container isn't filled to the top. Dispose of it before it becomes too full. Once filled to a safe level, securely fasten the lid with heavy tape to prevent any accidental openings. This method offers a safer alternative for needle disposal in the absence of formal disposal facilities.
You can always email the State Department of Health at this email and someone will be sent to pick them up. If you do pick them up and you get a needle stick, that's serious, and this is what you need to do. You need to contact a healthcare professional, and there are several ways you can do this. You can call the number scrolling on the screen. You can call your medical provider and talk with them, or you can go to an emergency department. There are several things that will happen. They will evaluate the risk of HIV and of hepatitis C, and perhaps offer you a tetanus shot. If the risk of HIV is significant, they may offer you post-exposure prophylaxis, known as PEP. I hope this doesn't happen to you, but this is also what you would do if you have potential contact with HIV through sexual activity or through sharing syringes. The Expanded Syringe Access Program, also known as ESAP, is part of Hope and Health for New Yorkers. For more information on how to become a provider or to find an access point near you, visit the web address or reach out to us on email, as you see on the screen. Together, we can make a difference in public health in New York State.